Okay, so a 70-year male student presented with breathlessness, abdominal pain, vomiting for 1 day. He has chest clear, abdomen is normal, random blood sugar is 335. Oh God, 335 indicates diabetes. So patient has abdominal pain with breathlessness and vomiting. Diabetes, what two condition, most common conditions happen is whether hypoglycemia or hyperglycemia. In hypoglycemia, patient become unconscious, but here what happened, there is hyperglycemia as well as patient has abdominal pain and breathlessness and vomiting. So what can be suspected? Three important: investigation and diagnosis and the four steps for management. So in hyperglycemia, abdominal pain, vomiting, breathlessness, we can suspect patient has diabetic ketoacidosis. So patient has diabetic ketoacidosis. For and three important investigation for this patient are urine serum ketone bodies in order to diagnose the ketone level in the blood, serum electrolyte, because in diabetic ketoacidosis serum electrolytes are disturbed. Patient has hypokalemia in initial state and hyponatremia as well, and hyponatremia results in imbalance of water balance, imbalance of electrolytes, and the patient may develop dehydration. So third investigation is ABG, arterial blood gases. So these three investigations are investigation of choice in DKA, diabetic ketoacidosis, and patient should be uh, uh, diagnosed on these three labs, on the basis of these three labs. So steps of management for diabetic ketoacidosis is IV insulin, because patient has hyperglycemia. In hyperglycemic patient, we have to give IV insulin, and fluid replacement, because patient has developed dehydration, and we have to infuse fluids to the patient. Potassium replacement, because hypokalemia occurs in initial state of diabetic ketoacidosis. So these three management. And the third one is antibiotic. There should be antibiotic as well. So, what is diagnosis for the patient? Diagnosis is absolutely diabetic ketoacidosis, because it is clear indication from labs, from clinical presentations, complaints of the patient. We have diagnosed this patient as diabetic ketoacidosis. So, diabetic ketoacidosis patient develops vomiting, pain, and breathlessness, increased serum, increased random blood glucose level (RBS). So, it can indicate that patient has diabetic ketoacidosis.